Today on NLC News, we will be discussing depression and mental health in the community, the role of the nurse. Here with us we have three experts, Angela Nickerl, Allie Erling, and Kylie Blakely. Angela, what would you say is the objective of your research?
Well, as public health students, we are very concerned about depression and mental health. To serve people in our community, we found an article that helps nurses understand ways that they can help. In this article, the author, Alicia Mendez, discusses the risk of depression in patients that live alone, are elderly, or people that are coping with physical illness. Public health nurses should quickly and correctly diagnose symptoms in these populations. Three public health nursing roles include recognizing depression and mental health concerns, offering these individuals support, and then providing them with appropriate resources. It's important for public health nurses to communicate effectively and be warm and empathetic with people that they meet.
Wow. How do we find these people to help them?
Well, for example, last Friday, I was in Dr. Cragen's cardiology office here in Provo. Every patient that comes in for an appointment, regardless of the reason for their appointment, fills out a mental health screening survey. That's a good way to assess where people are with their mental health in a population that could potentially be at risk.
So Allie, we heard a lot of stuff from Angela. What is the big deal? You can't die from being sad.
Well, actually, depression and mental health issues are a very big deal. They are a very common issue. The article that Angela mentioned cites some statistics that show that 1 in 3 people are dealing with mental health issues. And many people that have mental health problems are more at risk for other health issues. The article states the following: depression is 3 times as common in people with end-stage renal failure, chronic obstructive pulmonary disease, and cardiovascular disease, and more than 7 times more common in people with 2 or more chronic physical conditions. Equally, people with depression are at higher risk for other long-term conditions such as heart disease, for which the risk is nearly doubled. As student nurses, we have seen this problem as we have worked with patients in the hospital. Many patients with chronic illnesses are prescribed some sort of antidepressant during their hospital stay. However, there are people in the community living with chronic health issues or just living alone that don't have a bedside nurse to help notice these issues. So as community nurses or public nurses, we can notice these problems in people and people that are at risk for them and offer them support so they can know where they can turn if they need help or they want to seek resources.
Give them the meds, I say.
Actually, Michael, antidepressants and medications aren't always the best option. Some medications may interact negatively with these patients and the current medications they're already taking. So, for example, if a patient has been diagnosed with an antidepressant for anxiety, they can have a side effect of panic attacks. So this creates a medication cascade.
Wow, 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 wow. So what should we do then?
Well, those with mild to moderate depression actually can have a really big difference in their lives if they have things like talking therapy, behavioral therapy, self-education, exercise, or social interventions. These non-pharmacologic approaches are sometimes just a healthier and safer alternative.
So no meds?
Well, of course, for more severe cases of depression, antidepressants may be necessary, but even then, their use may be used in combination with therapy as a solution for helping the patients to find a balance so that they can resume their activities of daily life and perhaps begin to address some of the underlying causes of their depression.
Wow, I didn't know anything. This is Michael Scott, NLC News, reporting on my cell phone. Good night and good luck.